On September 12, 2006, I sustained a spinal cord injury playing football.
When I was pregnant with Mikey, I had a massive stroke.
Someone drove right into the back of me and crushed my legs between the bumper of my truck and his car.
I had a very stressful day, and I had a stroke.
And I was crossing the street, and I was struck by a motor vehicle.
I hit the median sideways, and I was thrown 128 feet from my car.
I was born with a very rare birth defect, and it's known as child syndrome.
And I fell 14 feet out of the ceiling, head first, onto a metal railing and then a concrete floor.
I'm WilliamConaboy, president of Allied Services Integrated Health System. My wife and I grew up here. We raised all three of our sons here, and we love northeastern and central Pennsylvania. That's why I'm so honored to be with Allied Services for more than 20 years. Allied Services was started more than 50 years ago by people just like us who loved this community, people who wanted to make a difference, and who knew the compassion and talent of the people in our region. We are truly proud of Allied Services' not-for-profit status, where any profit we're able to generate goes back into our facilities, our programs, technology, and our employees. We are one of the largest employers in Northeast and Central Pennsylvania. Allied Services employees not only provide great care, but they also contribute tremendously to the communities where they live and work. I know the amazing work our nearly 3,000 employees do, and I'm so proud to work with them. They really do perform miracles every day. Just ask your neighbors, your friends, family members, your doctor. They'll have amazing stories to share. In the next half hour, you'll hear impressive and miraculous stories from our patients. Their experiences really do say it all.
Inpatient rehabilitation. This level of service occurs in a hospital setting and provides intensive inpatient rehabilitation. It's for patients who can't return home by reason of medical and functional deficits. The goal is to return the patient home, and that's accomplished by a team of experts, including a rehab physician, nurses, therapists, social workers, dietitians, and psychologists.
On September 12, 2006, I sustained a spinal cord injury playing football. I was life-flighted to Philadelphia, where I stayed 13 days in ICU. Then later was transferred to Allied Rehab, where I was inpatient for 8 weeks. We're in ICU in Philly. I was not even able to lift my hands over my head. And when I came to Allied, they helped me steadily progress to sit up straight, even in a chair.
My name is Gina Tomasone. I've been a physical therapist here at Allied Services for 17 years.
She gave me 100% right from the get-go. From the first day I got here to the last day I left. And I just felt that I couldn't not give her my all. When she was giving me my all, it just wouldn't be fair.
It's very special. It's why you go into this profession. It's why you become a therapist, is to hopefully not only help someone, but to help them achieve their goals and to change their life.
Allied exceeded any of our expectations when it came into Kyle's rehab. We're very happy that we chose them.
When I was pregnant with Mikey, I had a massive stroke. We really loved our home in Annapolis, Maryland, and it was a very tough decision to return to northeastern Pennsylvania, but it was the best decision for the type of care and treatment that I needed. It was very personal. They involved my whole family, including my son. He would come to therapy with me on numerous occasions and sit with me and cheer me on. And my husband was a part of the process as well. They showed him what he could do to help me, but not hinder me. They just the personal touch is what I think I was missing in my other rehabilitation centers. We really appreciate the care and all the opportunities John Hines has given us in order to get our life back.
Someone drove right into the back of me and crushed my legs between the bumper of my truck and his car. January 1st, I needed an amputation. I was depressed, going through all the surgeries that I had. They were trying to save the leg, then they had to remove it. And coming up here to Allied, the people were fantastic. They were absolutely fantastic. The nursing staff, the doctors, the therapists, they were a great help to me. And within 5 days, they actually had me going home. I was able to transfer from a hospital bed to a wheelchair, hop around on a walker. I mean, they were all fantastic up here. My therapist asked me, where do you want to be in 10 days? I says, I'd probably like to be back to work on the 11th day if at all possible. And he says, well, let's see what we can do. And in 10 days, I walked out the door with my cane.
I never thought I would have a stroke. I couldn't stand, I couldn't walk, my speech was bad, and I really needed help. The confidence they have in working with you, it really gives you confidence even though you don't think you could do it. The one day she said to me, okay, today we're gonna stand up, and I thought, oh boy, I usually would have to stand with my legs up against something for support, but they give you such confidence that you really can't disappoint them, and you put forth that extra effort, and it really helps. And I can remember this one girl said, when I'm 80, I want to be like you. I said, but I can't stand up and I can't walk. And she said, you will.
I had a very stressful day, and I had a stroke. And I had had a blood vessel burst, I believe, and that deactivated the left-hand side of my body, and I just wasn't able to control things. I was trying to drive home, and I became incapacitated. Well, this is the first time I had ever had a stroke, so I was really in awe from everything right from the beginning. They just treated me so well, and everything that they taught me to do were things that they needed me to learn, but I didn't know it at the time. They were way ahead of my condition. When I was learning how to balance myself in a chair, they were positioning me. When I tried to stand up, I didn't know I couldn't, but they did, and they supported me exactly perfectly. And then when I started to walk, they were able to give me a cadence, a left, 2, 3, 4, heel, 2, 3, 4, heel, toe, and then eventually I progressed into a pattern of walking. Every day I get compliments from everyone saying, well, you haven't had a stroke, or that must not have only been a mini stroke. But I mean, I was out, you know, gone for almost a year. And, well, 6 months anyway, I mean. And they will say, oh, but it didn't affect you very much. You say, oh, it did, it was serious. It's just that I came back, I had a lot of help. I had a lot of guys. I mean, if it wasn't for John Hines, it'd be a different story, of course.
I was in Jacksonville, Florida, and I was crossing the street, and I was struck by a motor vehicle. So from head to toe, my injuries included a concussion, a broken nose, a partially torn rotator cuff, a cracked pelvis, a cracked vertebrae at L5, a broken fibula, a broken femur, and a broken ankle. I came back to Kingston, Pennsylvania. My father's Dr. Smedley, and he used John Hines for his inpatient therapy. So it was automatic that I would come up here and use John Hines for my physical rehabilitation.
Generally, the patient remains for 10 to 14 days. They'll require 3 hours of therapy in a combination of physical, occupational, and speech therapy. Allied Services offers this level of care in Wilkes-Barre at the Hines Rehab Hospital and in Scranton at the Allied Rehab Hospital.
Outpatient therapy consists of physical therapy, occupational therapy, speech therapy, and we also offer psychological services. Its goal is to get a patient back functioning independently within the community.
Well, I was playing a soccer game and I went up against this boy who kept beating me to the ball. So I wanted to beat him, and I went over to kick the ball and I extended my leg far, which ended up resulting in my ACL and meniscus injury. I went to the Moscow Rehabilitation Center, and it was 10 minutes from my house and 5 minutes away from school, which is essential to my family because we couldn't go any farther. It was very nearby, easy access. I worked as a lifeguard at Big Bass, and after my injury, I couldn't lifeguard anymore. I couldn't swim. I couldn't even walk to get food sometimes. But afterwards, I was able to walk, and now I'm lifeguarding again and teaching swim classes. Allied helped me get there. Without Allied, I would still be on those crutches, needing help all the time. They're great. They gave me the motivation I needed to get back up onto my feet. They were almost like family to me.
I needed orthopedic care. I had a broken ankle, and I had to learn how to walk all over again. They first of all convinced you that you were going to go through a course of therapy that would be uncomfortable, but that would be productive, and that you would be making a difficult choice, but it would be a positive one for your own recovery. And I've had pulmonary therapy there for breathing, for asthma, and they really and truly make it possible for you to improve the quality of your life. In our family, 3 generations of our family have been treated at John Hines. The children have learned how to do speech therapy there. The grandchildren have had positive experiences so that they're able to succeed academically. And my sons, who are grown men now in their 50s, they've all been there for athletic kind of injuries. So all 3 generations of this family have benefited by the services of John Hines. When you go to John Hines, you actually make a choice for the very, very best orthopedic care and the best care for any rehabilitation you might ever need.
I was born with a very rare birth defect, and it's known as child syndrome. There was only 63 cases of it when I was born. And it only affected my left arm and my left leg to be highly underdeveloped.
When she was first born, I was scared. I did not know how to help her. Stephanie first came to Allied Services. I believe she was only about 3 months old. And she continued 3 days a week for 5 years, right before she went into kindergarten. So she was completely, totally ready to face the world when she left here. And I chose Allied Services because I was recommended here.
As I was growing up, Allied has taught me to do everyday life things that you need to, overcome certain challenges that seem very easy to other people but become harder when you're physically disabled.
My experience with Allied is they had taught me there are no limits for Stephanie. And as a parent, you couldn't ask for anything more.
This is my first year, and for many years to come, on the United States Paralympic ski team. My ultimate goal is not only to compete and race in the Paralympics in Sochi, Russia, but to bring home the gold in the Paralympics in Sochi, Russia. The greatest miracle is creating life from somebody who may think that there's not much left for them after not only just a congenital disease like I have, but somebody who may have gotten into an accident, who think that they are now stuck. Well, Allied Services, they erase that thought out of you, and they bring that miracle of life back to somebody who think they may have lost it. And that is the very special thing that is, I believe, is only found here at Allied.
The patients come in for their rehab services, receive their therapies while they're here, and then return home after their services. They can come to therapy anywhere from twice a week, 3 times a week, sometimes 4 times a week.
I'm the Director of Physical Therapy at the Skilled Nursing and Rehab Center, and I manage the physical therapy department to provide therapy services to the residents on a daily basis. We have 2 types of populations. We have a short-term and a long-term population. Our short-term population is your residents that are there for a transitional stay, meaning that we're a bridge between the hospitals and home. Or say they're not ready to go to an inpatient rehab hospital, we have the opportunity to work with them a little bit longer to get them stronger and prepared to either go home with home health, with outpatient services, or to go to a rehab hospital for further therapy services. Our long-term population are your residents that really can't maintain themselves in their homes. So we provide 24-hour nursing services along with a variety of other disciplines that can care for the residents and manage them for a longer period of time.
I was on 81, I had a tire blowout, I hit the median sideways, and I was thrown 128 feet from my car. I was literally blown right out of my sneakers. My sneakers are in my car tied. I had head trauma. My front teeth were knocked out. I broke my ribs, punctured lungs, shattered wrists, dislocated knee, shattered foot. You name it, it was pretty much broken. I mean, to be 33 years old and put in that position where you need multiple people just to sit you up. You can't feed yourself. And for them to give me that kindness and compassion, I mean, it was just so appreciated. I know when people saw me, especially in ICU and trauma, nobody expected in 6 months I'd be back to work full time. I'd have my life pretty much completely back, driving. I mean, I couldn't read at first. I had head trauma. Now, I mean, I'm on a computer every day. I'm multitasking. I mean, in my opinion, that's a miracle. I mean, the fact that in 6 short months to have my life completely back, and I mean, I walked to my sister's wedding. Nobody thought people thought I was gonna be in a wheelchair at my sister's wedding, and to be able to do that, it was amazing. I'm doing my laundry, I'm back to work, I have my life back.
My mother is Marjorie Hibbler, AKA Hibby, and she's 94 years old, and she right now is in the Allied Skilled Alzheimer's unit. She was kind of going downhill. She was losing weight, she couldn't walk straight, and it was killing me because I didn't want to put her in a home. And then finally I talked to my sisters and we agreed that maybe this was the best place for her. And she's fantastic now. It makes me feel wonderful now because I know she's getting the care up here that I would give her at home. You know, it seems like everybody loves my mother, and it's a tremendous burden off my shoulders to know that she is being taken care of as well as she is.
I was in an industrial accident on May 17th, and I fell 14 feet out of the ceiling, head first, onto a metal railing and then a concrete floor. The accident left me with a fractured skull, bulging discs in my neck. I'm injured my shoulder, 3 vertebrae in my lower back, and I fractured my pelvis in 4 spots. I picked Allied because I had heard that they had such, a great reputation, and that's where I wanted to go. Right from the beginning, when I was admitted into the Allied facility, they told me that they would start therapy, and I told them, I'm only going to have a 15% chance of walking, and they gave me the confidence, and they just would never let you quit. My initial therapist was at the Skilled Nursing Center, and it was Mary and Mark. Mary was my physical therapist, Mark was my occupational therapist, and there was no quitting Mary. I mean, I owe everything to that woman, getting me started down the path that I'm in now. They don't do it as a job. It's a passion for them. They keep you going. When you're down, they bring you up. When you think you're not going to be able to do it, they encourage you to do it. It's just the best that you can ever get. I mean, it is. Allied talks about miracles in rehab. I'm a living, breathing proof of that. I only had a 15% chance of walking.
I truly believe that Allied Services and Rehab Center is tremendously different than any of the other facilities in our area. Being part of the Allied system, we're truly focused to provide quality therapy services. In addition to therapy, we have many specialized programs in our center, including respiratory services, wound care, pain management, and our Alzheimer's program. We have the best staff, the best equipment, the best programs to really set us apart from any other facility in our area.
Home health services are provided to those patients who comfortably live at home but cannot easily go out for outside appointments. They typically need several services. Among those might be nursing, health aid, medical social worker, physical, occupational, or speech therapy.
I was diagnosed with multiple sclerosis in 1978. Allied is very important to me. They come to me to help me, and they do everything which I can't do. This is Pat, my nurse. She is wonderful. She's been wonderful to me.
Well, I see Carol maybe once every 3 weeks. We do vital signs, go over all of her medication to make sure she's taking them, make sure she keeps her doctor's appointments. And if she does have an exacerbation, bring therapy in
We get along extremely
She's a
well.
wonderful patient.
This is my therapist, Cheryl. She helps me with my exercises to help in areas I need it.
I very much enjoy coming to work with Carol. From time to time, things will get a little more difficult for her, and so I'll come and go over with her exercises and stretching to keep her flexible. We'll go over safety and techniques of transferring in and out of bed. I really very much appreciate being able to help someone keep their independence or improve their independence or quality of life. Work on things that are meaningful to them.
And they make me feel good about myself.
We were on our way to go get corned beef and return a library book. The kids were 2 and 3 years old on 307, and we were hit by a drunk driver. Left side was crushed, my whole left side all the way, arm, leg, everything. I also had a significant head injury and the brain injury, and that has taken a lot of rehab. I don't even know how to put into words exactly how far we've come. I couldn't write. I had a hard time even forming whole thoughts.
It's been real exciting to watch her come from a point of being bedbound and not even able to get up out of bed into her wheelchair to being independent in her home and taking care of her family.
Now I actually have pots hanging here. You know, like, there's a reason why. That's because I can reach it and make a grilled cheese for my son. Being able to do things for my kids and my family is what it's all about, and being home. Being home. And I wouldn't be here if it wasn't for the help in the rehab. I have been blessed by having the staff from Allied that have come into my home have cared with such a heart that that makes all the difference.
Was in a hospital at one time, and had to be maybe 10, 12 years ago. And I had to go to Allied. They did a terrific job with me. I wasn't able to walk, and I walked out of there within a week with all the therapy and everything, and everybody was so great. They took special care. They treated you as a human being. And when I left there, they said that I would need home health. And naturally, I signed up for Allied's home health. And that's the day that I met my Florence Nightingale.
My name is Karen Gutowski. I'm from Old Forge. I've been working for Allied Home Health for 20 years, and I go to patients' homes and I do general assessments, their blood pressure, heart, lungs, blood work, wound care, a whole variety of teaching. Hal's been a patient of mine for about 10 years, and he's a great guy, has a lot of medical problems. So when we do come in, there's a lot of different things we have to look for in him, and you know, it's a challenge sometimes.
Your potassium hits 7, that you're ready to go into cardiac arrest. Mine was 6.9. That's a little too close for comfort. And if Karen didn't catch that, I wouldn't be here today talking to you.
It's very nice, you know, he holds me to a high standard and thinks I do such a great job, and I do my job to the best of my ability, and every patient I see, I hope I can help them in any way I can. At Allied, we treat everyone as an individual. Any issues they have, we would address, and everyone is treated with respect, courtesy, and we just all do our best for every patient.
Allied Home Health Services allows a patient to experience the quality of Allied within their own home. This quality is recognized in the fact that Allied Home Health has received the Home Care Elite Award 4 consecutive years.
Miracles in Rehab, performed daily. At Allied Services, it's not just a slogan, it's a state of mind that our employees truly believe in. If you or someone you love have a health-related issue that requires one of our services, ask your doctor about Allied Services. You do have a choice when it comes to your good health. We'd be honored to have you choose Allied Services.
I was born with a very rare birth defect. It only affected my left arm and my left leg to be highly underdeveloped. From infancy to into 5 years of my life, my childhood, I was here at Allied Services. My passion is alpine ski racing, and I did learn how to ski, and because of my physical disability, I was introduced to the Paralympics. Allied is a great place. They don't make you feel like you're there to get help. They teach you, how to live again.
On January 3rd, Karen came to check me. I was having difficult breathing. She said, "You better get to the hospital." I went to ER. I ended up 7 days in the hospital with congestive heart failure. And my kidney functions were gone and everything. And they said that I would need home health. And naturally, I signed up for Allied's Home Health.
Hal's been a patient of mine for about 10 years, and he's a great guy. Has a lot of medical problems. So when we do come in, there's a lot of different things we have to look for.
If she wasn't here, I wouldn't be here. You make sure you call Allied. They'll send the nurses in, and you'll have the best care that you ever needed.
I never thought I would have a stroke. I thought I was doing everything right. I couldn't stand, I couldn't walk, my speech was bad, and I really needed help. The things that they taught you to do and the way to do them really made the difference. I said, "But I can't stand up and I can't walk." And she said, "You will."
My right side, both leg and arm, were essentially paralyzed, and I was diagnosed as having a stroke. After 7 days, they sent me to Allied Skilled Nursing, and I went in there flat on my back, and 7 weeks later, I walked out with a cane. They were very, very caring.